Good afternoon, everyone, and welcome to our second discussion of today's Investable Showcase 2020. After our keynote this morning and some discussions around the wider industry dynamics and investment landscape, and then our China panel, our focus now moves on to the medtech and health tech and digital health landscape, which is another I guess, subsector of the healthcare industry, which has seen massive disruption and in some cases significant growth due to the COVID pandemic. I'm delighted with the panel of speakers that we have to walk us through this session, but I'll hand you over now to our chair and moderator for the session, Tina Tan. So Tina, the stage is yours.
Great, thanks Josh, and hello everyone. As Josh said, there was some discussion this morning about how the biotech investment landscape was. So in this session, we're going to be looking a bit more closely at the investment landscape within medtech. I'm Tina Tan. I am the executive editor of FirstWord Medtech, and what we do is we provide news and analyses of what's happening in the medtech and health tech space. And we've been tracking a lot of the venture financing deals as well as M&A deals. And there's definitely a lot of money flow happening going into medtech startups and scale-ups. And I have to say, I've covered this industry for nearly, well, over 20 years. I don't want to say over 20 years to reveal how old I am, but this is a particularly exciting time based on just like the breadth of innovations that we're seeing. And also, you know, I can see that there's a lot of like excitement among investors in terms of like what they see coming through this pipeline. And just to illustrate that we have been tracking up to since the end of October to illustrate how much money is going in. We've recorded that there's been over $11 billion that has already been raised as of the end of October, and that has surpassed the annual total from last year by a good $3 billion or so. So what we like to do today is take a deeper dive into those numbers, get an insight into the medtech investment strategies of these people who are putting money into these startups. Many of the big financing rounds have gone to health tech companies. So what's the divide between traditional medical devices and health technologies when it comes to investor interest? What type of companies are getting investors excited? So we have a great group of panelists today. They reflect the different profiles of investors that have been very active in the last 2 years. They can provide a unique perspective on what is driving their strategies. So if I could ask each panelist now to briefly introduce themselves and give an overview of the type of investor that they are, their funds and portfolio mix. And normally with introductions, I like to do this alphabetical order, just to be fair. So let's start with Andreas.
Thank you, Tina, and hello, everybody. I am Andreas Wipper. I'm representing the corporate venture fund of Fresenius Medical Care. Fresenius Medical Care is a global leader in providing care and products to patients who suffer from chronic kidney disease and are dependent on life-saving dialysis treatments. The corporate fund has been established back in 2016, and we have made investments into 8 companies so far. One of those is a pharma company, which we have, however, divested in this summer. So out of the 7 portfolio companies that we do have 1 investment in the space of regenerative medicine. We do have 3 investments in the health tech space, and we do have 3 investments in the more traditional medtech space. And if you, we invest, of course, strategically, and to understand better what means strategically for us, it's important to know that of the revenues of Fresenius Medical Care, over 80% is allocated in the providing care business, so that we are serving for more than 340,000 patients worldwide. And now it's less than 20% that are actually allocated to revenues from the product business. And that said, It means that there is a lot of efficiency gains that we can get by providing better care in our patients. And so of the companies we have invested in, there are actually two companies which are in the field of providing better care to patients, and that you might not originally think of that we would invest in that field. And one is a platform that provides, is a digital platform to provide transport to patients. And the second one is a digital platform to provide behavioral health care to patients. And you might not originally think that that is within space, but if you think that for chronic patients, you have that those with behavioral health issues have a much worse outcome and also incur higher costs, it makes a lot of sense that we have invested in that space. So that's to the space of the companies where we invest, and a few words on the sizes. So we typically invest in series A to C as a first investment. Our tickets are between 2 to 5 million, but we can make exceptions and have made exceptions. We stay below 20% ownership, so always minority stakes. And typically we ask for a board role.
Great, thanks, Andreas. So we've heard from the corporate investor. Now let's hear from Caroline.
Hi, so Caroline Gaynor here, some principal with Lightstone Ventures, which is a US-based life science investment fund. It was formed in 2012. We're on to our second fund now. We focus on both biotech and medtech. Generally, our ticket sizes of 15 to 20 million over the lifetime of the investment. I guess we would be what, in relation to this particular topic, more traditional investors. Having said that, within our medtech portfolio currently, we would have three that I think would classify as the convergence style investments. So we have Cala Health, which is a wearable for tremor. We have Willow, which is more in the direct to consumer, breast pump space. And then we also have Fire1, based here in Ireland, where I am based, and that's a remote monitoring solution for heart failure. And so I think, as we go on and discuss, it's something that's becoming more important to us. The current split at the minute is probably around 70% biotech, 30% medtech.
Great, thanks, Caroline. And then we have Pirkka, who is a bit of an outlier in this group, I suppose. Do you want to explain what your fund does, Pirkka?
Yeah, thanks, Tina. So Pirkka with Medtech Ventures. We're in a Helsinki, Finland-based fund, and as you alluded, so we're a bit of an outlier in the group. So we have a broader investment scope. So we're actually looking at partnering with a lot of companies that have technological innovations, even deep tech and brand-driven cases. So we've done, besides medtech and health tech, we've done investments in new materials, B2B SaaS, even cloud gaming. So kind of a range of portfolio that we have. 26 companies in our portfolio. We're investing from our first fund, now third year ending just end of this year. And kind of like looking at the things that we are looking at kind of broader range. So any industry that would have disruptions happening. So we see this also kind of on the medtech side, that software, AI, those are kind of coming in. We see a lot of new diagnostics areas, digital pathways, and things like that. But usually we like kind of things that would have a software component in them. Not necessarily, but I think typically a lot of things kind of has a software element in them. And the deep tech investment that we have done, we invested in quantum processors, so a company called IQM. They just raised a magnificent round, 46 million, to grow their business. So that was just announced this week, so super happy about that. So, but a couple of investments on the medtech side. So one is in the epilepsy seizure detection and treatment monitoring using video, audio, and AI. So you can kind of nothing attached to a person. You can extract the biomarkers and detect seizures. And the other one's in the 3D analytics of medical imaging. So basically, you can process better the images that you get out of the MRI systems as such. But those are just kind of examples that they are kind of, you can clearly see that they have software elements and as part of the solution. So that's briefly about us. Maybe one more thing that we're in early stage, that means typically seed or kind of early A rounds, so we get involved. Initial tickets ranging from 200,000 up to 2 million, but we have reserved 2/3 of the funds for follow-on investment. So we're kind of looking at following the companies in the subsequent rounds. And as long as kind of the valuations don't go crazy, we'll try to take our pro rata at least from the rounds.
Yeah, I mean, those really early stage rounds are extremely important, you know, for supporting those innovations and taking them through concept. And then finally, we come to Michal. I'm sure all of you know Michal. She's appeared in quite a few LSEC panel sessions and others as well, all around. They're very active in terms of medtech and health tech investment TriVentures. So Michal, over to you.
Thank you, Tina, and it's great to be part of this panel discussion. So I'm with TriVentures. I actually started this fund about a decade ago. We're a venture fund that is focused on both medical devices and digital health. We actually started with a focus only on medical devices, but we're the first investors in Israel, where I'm based, to invest and help pave the road and build the industry of digital health. And when I'm talking about digital health, it's from integration into healthcare systems all the way to direct to consumers and everything in between. We're great believers in working very closely with the startups. So we have offices both in Israel and then in the Bay Area. But we also love working with the industry. That's why a large part of our LP base, the investors in the fund, are strategics, because we believe in having this open channel of communication between the startups and the industry. So today we have healthcare organizations like Johnson & Johnson, Medtronic, Abbott, Boston Scientific, Cardinal Health, insurance companies, healthcare organizations with tens and hundreds of clinics and hospitals. And then we're very lucky to also have the newcomers to the digital health, groups like Samsung and Nikon and NTT and Sompo, all kind of, in a way, sitting on our shoulders and having a view to what's happening in the market. But it really helps not us as a fund, but mostly the companies that could enjoy those relationships. So we're very happy to have two active funds. One is really for company formation and pre-seed, and then another one for the mostly A rounds. We have a partnership with the largest hospital in Israel. We'll talk a little bit maybe after about why we need so much data in digital health, but data is a key. And that's why we also partnered with the largest hospital in Israel. It's called Geva Medical Center, which provides us not just the ability to do pilots in that hospital, but actually get access to the data and make it more accessible to startups, and through that accelerate the process of early stage innovation.
Great. So Michal, since you know you were the last to introduce yourself, maybe you can kick off with my first question, which is to explore, you know, how has the pipeline of opportunities over the last few years evolved? How have you seen the types of investments that are coming through to you changed? Has it been a sort of, because you have quite a good mix of medical devices and health tech. Are you seeing, we know that health tech has just completely exploded, you know, because of COVID, but have you seen a sort of like a slow burn last few years and then everything has just surged, you know, that this massive glut of like health tech investment opportunities coming this year, or I don't know, you tell me.
Well, maybe we'll divide it to the two different sectors. You mentioned medtech and you mentioned digital health. So medtech, I think, was very, very active in the past decade. Over the past several years, you know, probably when we started the TriVentures, it was in 2010. Probably 90% of the investors have left this field. And we had a kind of a few years of lack of capital for many different reasons. But the result of that was a decline in the number of started startups that have evolved. And I think that there are startups that we have and we're looking at today. There was kind of a maturation of not just things that are doing nice to have, but more of disruptive technologies. And but definitely the medical space have changed in the past decade, I would say, in a very dramatic way. From features to disruption, but much less startups that are in the field today. In terms of digital health, probably it's the opposite. You know, when we started talking about digital health in 2011, there was nothing to talk about. I remember we did a course in Israel back then and people thought that we're crazy. And only in 2013, we did our first investment. And even then it was hard to find what to invest in. But this sector have evolved in a very rapid way. And today you mentioned earlier about the raising numbers of capital that is going into this field. I believe that we'll finish this year with $16 billion invested only in digital health. Companies that have grown. And I think 2020 for the digital health space is a tipping point year. Not only because the number of startups, but actually because of a lot of companies that grew and became meaningful companies. We had in this sector about 14 IPOs just last year. And I think this is part of the process that this industry is going through. So the COVID didn't start digital health for sure, but definitely expedited it. In 2019, it was expected to grow by 5 times in the next 5 years and become a $500 billion market by 2025. But I think this year came the COVID and kind of shaved probably a decade of hard integration. And that's why we see it coming from the backstage to the front stage with the help of COVID and people understanding that, you know, health is part of our life, an integral part of our day-to-day life, and doing things with telemedicine and seeing your doctor online, etc., is something that is possible and is actually more convenient in many times.
Mm. And I wanted to ask Caroline, because you within this panel, Lightstone is sort of similar to TriVentures, another more sort of traditional type of VC firm, but you have a heavier sort of like inclination towards biotech investments versus medical devices. Would you say that that this interest in health tech has sort of changed, impacted any of your overriding investment strategy? Is there more interest within, you know, among your LPs, for example, in health tech investments?
I would say so. I think, you know, coming up to and before the pandemic, there was definitely, you were seeing rumblings of remote programming, monitoring, an array of devices. It was becoming increasingly important. But I think, you know, having these features as part of your device offering are now becoming more paramount. I mean, COVID in many ways has changed the status quo for how healthcare providers are going to treat patients now and into the future. You know, and that's also compounded by, certainly in the US and all systems across the world, looking to drive healthcare costs down. You're looking at using these types of remote monitoring to sort of increase patient access to care, and at the end of the day, get greater value for the money spent. So, you know, I think that's been huge in accelerating that and really pushing it to the fore. And I certainly know at Lightstone, the types of deals we've seen over the last year are ones that either wouldn't have necessarily come to us, or, you know, they would have, and maybe we found the tech was just too much of it. Whereas now I think we're far more at home at looking at those devices. I still think we like to have a device. So we're probably not going to get involved in, you know, the more telehealth unless there's an actual therapeutic outcome or something that can be measured. But I think that's where we're finding our happy place right now. And there's certainly plenty of opportunity out there within that specific space that, you know, we can still bring our vast knowledge in the medtech specific area. And then, you know, a lot of it's around the team you bring on for the software or more tech enabling part of that. So yeah, I think it has changed how we're looking at investments and how we see ourselves moving forward in the medtech space from here on in.
That's interesting. I want to ask Andreas, because Fresenius is very much, it's known to be one of the biggest of dialysis service provider, very entrenched in the traditional sort of like medical device space in terms of your offering in dialysis. Have you found that within the venture arm, are you getting health tech companies approaching you more, saying that these are the ways that we could help, your business? Or are they thinking, oh no, Fresenius, we can't really see any alignment? Well, what has your view been in terms of like the opportunities, the investment opportunities that are coming to Fresenius?
Obviously, as you would expect for corporate venture funds, the strategy has not changed or has not been impacted by COVID. So the investments we have done in health tech, we did back in 2018. And this year we have done an investment in a traditional medtech company. And the next investment we will close soon will also be in a traditional medtech company. What we see is that companies, digital companies that have been in contact with us before and trying to match something that is around kidney, now coming back with offerings around COVID. So those digital companies, especially if you think about those offerings in basically post-discharge monitoring, for example, they came back with this offering, but we have decided currently not to invest into something that is just jumping on the COVID track. So of course, corporate has been looking, for example, into fast diagnostics that could be applied when patients arrive at the clinic. And we have seen a couple of companies that also reach out to us with point of care diagnostics that would fit into that space. But we decided that from an investment perspective, the time frame is more on the longer scale, and the need for these tests would be on a very short scale, and we may not hit the right one. So basically, we have not much impact from the COVID situation on the investments we make, and little only into what is in terms of deal flow, people coming to us, as I said, more adding the COVID feature to what they already had instead of offering us something digital. So that is a longer trend with people offering us digital solutions.
Okay, and Pekka, because correct me if I'm wrong, you came into medtech quite recently. Was it you've got 2 medtech investments, and it was in 2018, around that time frame that definitely pre-COVID. Would you say that now you are seeing a lot more sort of the uptake of like health technologies, the window there of opportunities now flung wide open? Are you seeing like more opportunities to invest and penetrate deeper into health?
Yeah, absolutely. I think kind of like, even if we look at kind of like not this current year, but earlier, I think there's been a number of kind of innovative companies on wearable sides. So there's kind of a lot of stuff happening there. I think that even though the quantified self trend has been kind of there for long, but I think we've seen a lot of clever innovations happening in that space that are both being used on the kind of health side and also kind of as medical devices. So that's been an interesting space. And I think, the previous panelist there earlier said that this year has really been kind of the breakthrough for a lot of the remote working digital pathways. I think kind of that's been a huge breakthrough in the market, and that has been tried for a long time, and now finally kind of like we're seeing more mainstream applications there. And then obviously there are an influx of new companies that are kind of trying to ride the wave there. And I think also artificial intelligence, machine learning being applied to, having large data sets available and helping in diagnostics areas. And there, I think there's always like we're always sometimes surprised, kind of like the innovations that are coming in there. Obviously, it takes quite a while to validate them. That's usually the problem with AI and ML. Kind of like, how do you validate the results and how it goes through the clinical trials and so forth. But at least kind of like for kind of like early indications there, and we can see a lot of great startups being established. But I think in general, kind of like where we're looking at other industries as well, I think the trend of remote working, digitalization, all of those, it will be interesting to see how that kind of like, hopefully when the worst of COVID is over, how quickly we go back to flying and traveling, and sometimes the memory of humans is short, so we kind of feel that this is a permanent change. I think there will be a different kind of world in 21 and 22, but probably won't be as extreme as we are experiencing today.
Mm-hmm. Yeah, I think we are actually already living in a different world than we were, at the start of this year, I think. I don't think we'll wait until next year to see, the difference. But before I move on to the next question, I just wanted to remind everybody to please send in your questions, share with us any comments or observations that you have as well. We're happy to share them among the panel and comment on them. So, okay, so Pekka, you talked about, since we had Pekka talk about, their move, Maki's move into medtech, I wanted to touch on this topic, which also Michal so brought up about how basically we've seen the rise basically of these health tech companies in the public markets. That's now the IPO window has been open for longer than I can remember now. This year, there seems to be loads of health tech companies, joining the unicorn club. And I was just wondering, in terms of doing deals, how, because we're seeing tech investors and like the traditional non-healthcare investors coming in. I'd be interested to know, Michal, because your LP, you have a quite good mix of LPs or corporates, but also the traditional tech companies. How easy is it to do deals in this very converging landscape right now? With everyone's opinion. Is there any clashes of what people think would work and what makes a good investment?
That's a good question, because the market is changing, and we see it. For many years, I've been asked, who's going to take the lead on such a change, right? Because it's not just digitalization, it's not just Uberization now, bringing the care to our home or to our office or to our mobile. It's really a revolution. And for many years, we thought, will the healthcare people kind of take it and move fast enough to ride this wave, or will it be the tech? Because we've seen a bunch of different acquisitions and involvement, and we saw Amazon with PillPack, we saw even Best Buy, a very traditional, not even a tech group, buying Great Call and buying Critical Signal Analytics and converting their Geek Squad to bring those technologies and implement them and monitor people at home. So we see this shift. And I was always asked, who is going to take the lead? And I think this year, just like I said, the interesting part is that the companies that started with a digital native, I would say that their DNA was originally digital health, have grown and became big companies themselves, and then they went to be public, and what happened in this year with all those markets on steroids, we saw a company like Livongo, right, which went public 15 months ago with an evaluation of, they went public at a $3 billion. Now they're at $15 billion evaluation. If you look at Teladoc,
that went public a little bit earlier, but this time last year, it was $4 billion. Today, they're also almost $20 billion, and those two companies are now growing. We saw American Well with the telehealth platform went public a couple of months ago, and also their value is growing. And I think what will happen, Tina, is that all those unicorns, now they became so big and so fast, they will have to go shopping themselves because they have to justify those huge evaluations. And we're advisors to some of those corporates, the new ones, the new digital unicorns. And it's amazing because they're asking us to look at other technologies and augment their platform. So now we don't have only the tech and the pharma and medical and insurance companies, but actually we have those unicorns that will take, in my opinion, the telehealth platforms and build the next level of personalization and engagement and additional tools that there's so many startups, I would say, and solutions to streamline the processes of care outside the traditional kind of hospitals.
Okay, that's really interesting. I wanted to, actually, we have a couple of questions coming through, and I thought I'd just break up the discussion a little bit to respond to these questions. Because Caroline, I think your background, you came from Bayer, didn't you? And so, which is very based on like reproductive health, and this question is quite specific. It says, with all the interest in digital health, where do you see investments going to monitor reproductive health hormones in the wearable device area? I mean, is this one, I have actually seen a lot of Femtech companies, and they're getting so much investor interest. Is this an area sort of like the convergence of like health tech, medication tracking, and things like that? Is that a really hot area within reproductive health? Is it something that Lightstone has considered before?
Yeah, I think we've seen, as probably all the panelists have, a huge number of companies and startups going after this very space. I think it is growing. I mean, Femtech is really seeing a revival, about time too, but I think it lends itself by the nature of, you know, it's part of a woman's lifestyle. It's not necessarily an illness or something to be solved, but it's something increasingly important as we're seeing, you know, higher maternal age and all of those things that just mean that reproductive health space is becoming increasingly important to people. You know, they're seeking knowledge, they want to know, they want to understand. And so I think the right type of device is important though. I mean, certainly back from my days even in Bayer, when we were at the very early stages of looking at ways to, you know, help women understand and track their reproductive cycles, the ease of use piece is just huge. And, you know, if they have to do something every day, it's just quite a high barrier to entry. So that's why, and I know that it was specifically about wearables, you have the right type of wearable, discreet, you know, non-obtrusive. I think that probably is the space we're going to see the most take care. So yes, I think it continues to grow. Is it something we'd invest in? I think we could look at it as part of maybe one of the companies we have. I don't think we'd invest in it as a standalone simply because it doesn't have a therapeutic outcome. Now, if you were looking to use it, say, as part of something like endometriosis, where you're impacting that disease state or informing therapy or something like that, maybe, but just straight up monitoring of your, you know, your hormonal system, no. But yes, it's really undergoing a huge, it's an area of growth at the minute, and probably Michal has seen some further.
Yeah. We've seen a bunch, and I think one of the, you're very right, Caroline, about the Femtech. We just saw another unicorn come to life, which is called Hims and Hers. You know, started with a platform that has to do with male, not necessarily disease, but things, wellness and creams and hair and pills that are more relevant to men and then to women. And I think that we'll see more and more of those kind of more bigger platforms, that part of them will be the therapy and part of them will be the diagnostic and part of them will be the monitoring. And part of them, some of the things we've seen lately is in the workflow efficiencies within the labs, for example. It's unbelievable, but a lot of those processes within, IV clinic, for example, are doing it in a very manual way. So imagine not just looking at how we can increase the efficiency in a clinic or a hospital or for that matter, IVF lab, but think as a solution that will take that and include the family, the woman or the man involved as part of this whole solution. And we've seen some, marketplace activities for those purposes to connect between the different market supply and demand. So definitely I see a lot of technologies, probably like you guys, that tackles different elements, and some of them are trying to put them under one umbrella.
So would you say then, Michal, that now investors like yourself and the rest of the panel, would you all be looking for things that could fit into a more holistic solution, not just invest in a standalone technology or a standalone device or product that is looking to go out in the market, but to be part of to provide one important part of that whole jigsaw? Maybe Andreas, do you want to think, because I suppose you have a very with Fresenius, you have a particular view, but then you're investing in different parts. Are you looking at moving at parts that you can add to Fresenius that would provide a more holistic solution to your customers?
Yeah, absolutely. So if you have a company that is, for example, in developing any type of life sign monitoring, and you have a doctor that takes care of a chronic patient, he doesn't want to have like different or 3 or more different platforms he has to use to get the data of the patient in. So they all have to be integrated. And I think that those companies have to be open to be integrated into broader solutions. I don't think they would be asked for everybody to build up their platform on their own and integrate themselves all the other stuff. So some of them may have just a very, that's a technology for us as an acquirer or an investor is actually the gold piece of it. But we see many of these companies believing now that the data is a new gold, and they're trying to prevent that data and create the story around that. And thereby they are somehow shielding the data and being not really open to be integrated. So my advice is that they, of course, have to show that they can do the digital part, but being open to be integrated into an acquirer's system or a customer system for the data to be integrated into a platform. Okay. And what we also do is we are testing with those companies typically in a pilot if it makes sense for us to use those. So that means we will run a limited trial in a couple of our dialysis centers to test those digital solutions, because we first want to see if it's really there's usability, if it integrates into the workflow, and if there is the outcome that we expect. And only after that, there will be a full integration or rollout into the different or all of the centers that we would be operating.
So you'd be looking at something that could already integrate into into your existing sort of infrastructure. Because one of the things about the, I suppose, challenges is how do you scale up health tech? How do you achieve that widespread adoption of that particular technology? Because you can't commercialize it. I mean, I suppose you don't commercialize it the same way as a traditional medical device. You need to, have sort of a different approach to it. I mean, how do you think?
Yeah, I think that has much to do with for a health tech was a traditional medical device with a need for an integration into the IT platform of the customer. So what you have is that there's like different lead times between first contact of the company to a potential customer until the customer actually converts to it, because it has to adopt its IT systems to it. It also means, like what I said before, we are doing like pilots with these customers or with these startup companies. So I have to be prepared that the customer will not do a full rollout, but first a pilot. And I think the customers are different. For a medtech device, you can have a single hospital just buying like one device. But if you have a IT integration, you typically do not go to a single hospital, but maybe to chains. So we have different sites where that would be operated, because changing IT infrastructure and running those pilots is an effort that makes only sense for a startup company to invest if they after that will have like multiple applications of this. So this is not just a one-time sell, but actually a continuous business and roll out to all of the potential customers' sites and centers. So the customers are different, I would say.
Okay, thanks. I have a question here from Nick Houseby, and this is a straightforward question for all the panelists here. At what point should a medtech company come to you with a Series A investment proposal? Is it 12 months prior to that, or just, I don't know, a bit closer to the time? Maybe we can start with Pierre, because I know that you said you invest in seed and Series A. When should an investment?
Yeah, that's always. And first, we need to define what do we mean by Series A. I think those are just kind of labels. But if we would say for any given round, let's say it's always better if we have a longer dialogue and we get to know the team. We get to see how they progressing with their kind of towards their metrics. So they're able to deliver what they promised. So I think that kind of helps to establish the trust, and we get to know kind of each other. It's always I think as well as we are evaluating the companies, I think the company should be evaluating the investors. They kind of like, it's a long-term relationship you're kind of engaging with. So the more time you have for dating, it's easier to do the investments, and I think it's better for both parties. And I think that the tricky part here is then kind of like looking at what sort of evidence you need, and kind of like how much funding you're looking at, what instruments are available, and usually kind of like if we compare medtech to other spaces where we invest, I think in, like, for example, in SaaS, you could probably flip a deal quite quickly. And then our experience is here that at least kind of 1 year is kind of a good expectation to have a good process for an investment round.
I see Caroline and Michal shaking, nodding their heads in agreement with Pirkka. So Michal, I mean, on average, when a company approaches you, say, looking for a Series A, investment, around what time do they? Is it normally too early or too late do they approach you?
No, I'll answer it in an opposite way. When we're looking and working with our startups, I always tell them, it takes 6 to 9 months to close a round. And just like Pirkka said, the relationship between investors and startups is long-term. It's a marriage. But unlike in the real world that results in about 30% divorce, those are not, this is real marriage for a long time. So I think that we feel very comfortable knowing that we're spending a lot of time with people that we're not going maybe to invest at the beginning, but we build a relationship, we monitor those companies, they see us. And I think it's important companies have to ask questions, and as much as we're doing diligence on them, they have to do diligence on us. The arrow has to go both ways, but it takes about 6 to 9 months to build the relationship, to do the diligence, to finalize the agreements, and to many times build the syndication that you have to bake in this timeline.
Caroline, do you want to add anything? Because I believe Lightstone has done, co-investments with TriVentures before. What's your view?
Yeah, Indeed, and I'm not sure that I have a huge amount to add to all those good points that have been made. The other thing that's maybe important to consider is the stage that the venture fund are at in their fund cycle, because sometimes you can be quicker or slower depending. So if you come in at the early stages when, you know, we're, I guess, more open to jumping in super early, I think, you know, that 12-month window is relevant and get to know each other and all the rest of it. If it's a later stage deal where it's been de-risked to a greater extent, I think possibly we don't need the full 12 months, you know, as we get towards the back end of our fund cycle. But yes, certainly when we come to seed and Series A, I would think reaching out a year ahead to start that relationship development is a good idea.
Great. So unfortunately, time is running out as always with these very interesting discussions, and things are, you know, we're getting into the nitty-gritty of things. So just to wrap up, I asked the panelists to look into their crystal ball and tell us what they think, you know, the investment landscape would look like, what the pipeline, you know, because I started with what the pipeline of opportunities have been looking like, how it's evolved. Now I'm asking them to look forward over the next 10 years. How do they see it, you know, changing? And maybe let's start with, let's do it alphabetical again. Andreas, tell us what you think.
Yeah, so I think that the driver behind that is really the change from the reimbursement system from fee-for-service to outcome-based or value-based care, so that in fact you're paid not for what you deliver, but what you achieve. And I think that there are a lot of opportunities in that space, and that starts from identifying those patients from the data that are already existing who are at risk of not achieving that. It goes into home monitoring to add basically easily available, maybe non-touch life sign data to that to confirm or to add to identifying those patients at risks. It goes into personalizing therapies, maybe with a point of or accompanying test to that. So like a company you are currently looking at into personalizing, basically adopting the immunosuppressant therapy for transplant patients. So I think there are a lot of, there's one driver and a lot of opportunities within that space. And a lot of that solutions will be digital or have a digital component to that, or a more personalized patient-centric component.
Great, thanks, Andreas. Caroline?
Yeah, so a couple of things. I guess the recent proposed CMS coverage of these innovative devices might actually rejuvenate the medtech sector, and that combined with the convergence we're seeing with tech, we might see more investors come back to the medtech space, you know, and invest actively there. I also think, you know, it really is time for companies that are able to compete with what would traditionally be done in the doctor's office or in the hospital, you know, to capitalize on it. It's really a golden opportunity to accelerate that shift. And I do think we'll see far more companies coming with solutions, whereas in the past, you know, we had issues around reimbursement, who's going to pay, how's that all going to work? All that's been accelerated. And so when I think for at least the next couple of years, there are two things that I think will be opportunities for the sector.
And Pirkka?
I think there's still kind of a lot of inefficiencies around us. So I think still we'll see a lot of innovations that will just boost the productivity and boost the outcomes. And I think that's definitely a space that I would expect that we'll see a lot of innovation still happening, because we still kind of like comparing to many other industries, still, even though we got a little bit of a digitalization boost, it's still in many areas there's ways to go. The other one that I'm super excited about, mentioned the quantum investment that we did, that once that gets into use, so kind of like we have hardware and you have the capabilities that is not available with the traditional computers today, that what that can do to drug discovery and new kind of material design and everything. I don't know if that's happening kind of in the next year or 2 years, or will be 5 years ahead of us, but at least kind of like that's the biggest thing I would say in my crystal ball, that we'll see kind of innovations that we can't even imagine today on the drug side and new materials.
Great. And I'll let Michal have the last word.
Well, I would say that the trends that we're very excited about are the accessibility, how to bring things outside the hospitals to our mobile and home, and the consumerization. You know, instead of looking at the patient, look at them as a consumer, and they have much more power than I think they used to have. And I think a lot of it will come in a way that is different than what we've done today. There'll be a convergence between industries. We'll see more companies growing together from the base, from fintech, insurtech, and healthcare, and cybersecurity and healthcare, and consumer platforms and healthcare coming and building full solutions. So we're at a very, very exciting time.
Great. Well, that just leaves me to thank everyone for their contribution today. I hope the audience have found it as useful and as interesting as I have. And I'll just hand things back over to Josh.
Thanks so much, Tina. Yeah, let me reiterate that thanks to all of our panelists for joining us today and sharing their insights. And Tina, as always, for fantastic moderation of the session. This session will be available sort of immediately. So if you are rejoining a later date or missed it earlier and rewatching at a later date, you can still ask those questions, answer the poll, and sort of interact on the platform. And we can look to answer some of those questions as we move throughout the rest of the event as well. So we're back at 2 o'clock with our afternoon keynote presentation from Chris Picariello from Johnson & Johnson Innovation, and our external internal convergence panel, which has been the pervading theme through a lot of the discussions this morning. So look forward to seeing you all at 2 o'clock UK time. Thank you.